Black lights and booze burn when I record for Watts, and every black like Troy Davis who never had a fair shot.
Welcome to Left of Black. I'm your host, Anthony Neal. We are joined today by Dr. Allison Matthews, who is a postdoctoral fellow at the Institute for Global Health and Infectious Diseases at UNC Chapel Hill. She's here at Left of Black to talk about her project to beat HIV. How are you doing today, Dr. Matthews?
I'm doing great. How are you?
I'm doing very well. So tell us a little bit about To Beat HIV.
Well, the project is a crowdsourcing project. So the idea is that we use crowdsourcing contests which allow the public to collaborate to come up with ideas and solutions to particular problems. We use these crowdsourcing contests as a way to raise awareness about HIV cure research and engage people in discussions about social and ethical issues related to clinical trials for HIV cure research.
So this is really work that, folks have been obviously working on trying to find solutions and cures to HIV for a long time. But this is really taking advantage of some of the newer technology, particularly social media, to be able to engage broader publics, the kind of publics
Right.
that folks that, researchers might not have had access to in the past to think about ways to address this issue, particularly in Black communities.
Well, yes, and part of the reason that we even took that approach was because we did formative focus groups to ask people what kind of project basically I was hired to do crowdsourcing. They gave me one paragraph on the grant that said, okay, you do crowdsourcing and community engagement, and this is what it says in the grant. So come up with a project based on that. And so I started off with focus groups asking people, what do they want? What would a project like this look like? How should we reach Black young adults? And through that process, I learned that people wanted to adopt a collective approach to this, saying that everybody had some type of ownership and they needed to be empowered to be involved in cure research, and that social media and music and hip hop and creativity were great ways to kind of harness the strengths of the community and get them involved because a lot of people felt like they didn't have much to contribute because they didn't have a lot of knowledge about HIV or knowledge about clinical trials. But if you could find ways to identify and really leverage the strengths in the community, then it can be a way to get people involved.
Now, your research examines the stigma that's often associated with HIV, particularly young Black men, and their relationship to Black institutions, notably the Black church. How much of that research fueled your interest in coming up with this model around crowdsourcing?
Right. Well, ironically, when I finished my PhD in sociology, and the research that I did was examining the strategies that Black gay men use to deal with stigma in churches and kind of deal with this overlapping stigma with being Black and gay and how they make decisions about what churches to go to. And this theme kept coming up, this kind of association with people living with HIV. And even if men were not infected with HIV, they still had to deal with this additional stigma. So it was something that kept coming up in the interviews and in my observations, this kind of conflation of sexuality and Blackness and disease and death, really. People associate being Black and gay with dying, which is, I think, part of the reason why there's a stigma around HIV. And so it was kind of a natural extension for me to start thinking about the issues that we deal with in our communities around racism and sexism and homophobia. Are HIV as a symptom of that, right? We have these consequences of dying, and HIV is not a death sentence anymore, but people are still dying from HIV, from complications with AIDS. And if you see HIV as the symptom of this larger issues of racism and homophobia and sexism, then that would just seem like a natural extension for me to start exploring those topics.
You mentioned that you think about a figure of someone like Irvin Magic Johnson, right, who has lived, it's more than 25 years, vibrant and healthy, when we see him. There's a way in which when you think about the fact that there are people living with it now, it raises the question about the folks who continue to die with it being in really precarious situations already, right?
Right.
How does the kind of healthcare disparities that we see, regardless of what someone's HIV status might be, affect those who have HIV? I mean, if you're not going to the doctor, regardless of whether or not it's cancer, HIV, or diabetes, right, it's going to be a problem. How do these healthcare disparities even complicate the conversations around HIV?
Well, one of the things that I want to say is that people come up to me all the time asking, is Magic Johnson cured of HIV? And no, he's not.
Right.
But people don't understand that the medication has gotten to the point, it's so good now that
Right.
people are living a full lifespan, and his viral load and others who are on HIV medications have gotten down to undetectable.
Right.
And what that means is if you take an HIV test, it won't detect a virus in your body. That doesn't mean that you don't have HIV.
Right.
But part of the issues around the health disparities, especially, with that point, people living with HIV and who are on medication actually have access to a lot of great resources. They're living long, happy lives, and they still have to deal with stigma, but they are, in a lot of the focus groups and people that I've been talking to living with HIV, they feel like they're very well taken care of. But there's this disconnect, these issues around the myths, right? So these myths of Magic Johnson being cured is informed by and layered on this history of racism and socioeconomic kind of oppression, in the sense that people think that pharmaceutical companies and universities are purposefully withholding a cure or access to medication from the Black communities.
Right. And this is, the offshoot of folks who are remembering the longer history of the
Right.
Tuskegee experiments, right?
And it's not just Tuskegee. There is a case that was just settled here in North Carolina of doctors sterilizing women
Right.
without their knowledge. And
Right.
they just settled that like 5 years
Right.
ago. So yeah, people are very aware, very acutely aware of these things, these issues with medical systems and research. And so part of the issue with people wanting to access or getting access to medication or getting tested or participating in clinical trials is kind of colored by this history and present situation of these kind of abuse between and mistrust between clinical trial researchers and the community.
What has the response been so far to the To Beat HIV project?
I have actually been very excited and surprised by.
I know you've done a lot of media.
Right.
stuff around it.
By the response, people are excited about it. I think partly because we're talking about finding a cure. There's been, a lot of people are getting reintroduced to it and more excited about it. A lot of people previously have thought, I know everything I need to know about HIV. People aren't dying anymore. Why do I care about this anymore? I know I just need to use condoms and that's it. But if you go in and you talk to them, well, actually, no, there's advancements in medication. We still need to talk about what doing clinical trials and doing research in Black communities mean. Does that mean that we, as researchers, I kind of wear both hats. So as researchers, do I just go into your community? Are you going to allow people to go into your community, get the data that they need, and then leave? Or are you going to really take the time to understand what's happening and be involved in the process and make sure that the medication that they're developing or that the research design benefits you and your community? There's millions, billions of dollars available. I think that's one of the things that I kind of, rate in the point, like there's billions of dollars available for us to be involved in this and to shape the future of a cure in a way that not only understands the social issues around access to healthcare and racism and violence in the community and mistrust between, researchers and the community, but also being able to make sure that we have access to this cure once it comes out.
You're watching Left of Black. I'm your host, Mark Anthony Neal. We're here today with Dr. Allison Matthews, who is a postdoctoral fellow at the Institute for Global Health and Infectious Disease at the University of North Carolina, Chapel Hill. You go back to 20 years ago, and I'm thinking specifically about like the work of someone like Kathy Cohen, who did a great job of kind of capturing what were the early moments of a social panic within the Black community around Black men being on the DL. Right. And it seems as all our conversations about HIV within the Black community began and ended with that conversation. Have you seen a shift in the narrative around HIV and same-sex desire within the Black community so that we're not all talking about as we were, 10 years, I think about J.L. King's work, as one example of this, where we seem to be so fascinated more than anything with the DL as opposed to actually dealing with safe sexual practices and also, thinking about cures for HIV.
Unfortunately, I don't think that there's been a major shift. I think that, people are still kind of using men who have sex with men as a scapegoat, or same-sex, same gender-loving men as a scapegoat for HIV and the disease in the Black community.
As if heterosexual Black men don't have unprotected sex with multiple partners. Right. Also, right.
And also missing the point that Black women
right.
are represent a large percentage of women living with HIV
right.
and older people. The rise among people 50 and older is actually increasing. And then there's also this conversation about, this is not necessarily to your question, but there's a rising rate of HIV among white men and women who are using heroin. There's a heroin epidemic. And I'm kind of curious to see if the conversation about HIV is going to come back to the forefront because white people are dying or white people are getting infected with it. I think there's this, there's the conversation about the disease being associated with a stigmatized group of people. I think is easy for us to dismiss that conversation as if it's not important or relevant to the rest of us in the community, but it really does leave out this whole conversation about what it means for us to have safe sexual practices, but beyond just safe sexual practices, what it means for us to have access to health care. Yeah. Because Black people don't have different sex than white people or Asian people or Latino people, but it's that access to health care that really drives home the epidemic.
If the Black community had been talking about HIV much over the last few years, interest has picked up recently with the death of Bishop Eddie Long and speculation about what his status might have been with regard to that. How do you interpret generally the conversations around the Black church at this moment, right? Eddie Long is kind of a focal point. When folks saw his physical demise, if you will, the immediate speculation, right, is that it must have been that, and of course that's tied to his relationships with young men earlier. As a researcher, how do you navigate those kinds of spaces to do the work that you need to do?
Well, from what I've heard, one of the families of the young men who settled with him, he has HIV, and the families are claiming that he probably gave it to Eddie Long. So I don't think it's just speculation about him in relation to the men, but also there's some people who are making those claims. Right. But there's this, how do I navigate that? I think in the research that I did with my dissertation, men really had to make decisions about what types of spaces they wanted to be a part of. And especially because they were stigmatized for both being Black in predominantly white gay churches and in wider community, but then also being stigmatized for being gay and predominantly black, non-gay affirming churches. A lot of people were founding their own churches that were black and gay affirming, or finding other ways to practice their spirituality and stay connected to churches.
Think about Carl Bean's work out in Los Angeles, you know, in terms of creating one of those safe spaces. So yeah.
Right. I mean, I think that's part of it. Even with the work that I'm doing with the HIV cure, clinical trials, and to beat HIV, is creating safe spaces for people to have these conversations and to kind of process and deal with stigma, but also to be able to be empowered and have a say in what it looks like moving forward and how we kind of address these issues. I think that's one of the beautiful things about crowdsourcing, is that I'm not coming up with the ideas. I'm not saying yes or no to anything. It's you coming up with the ideas, you coming to me and me saying, I have the resources to help you bring this idea to fruition. That's one of the ways that we kind of navigate that, is not just imposing my thought process or my education or on people and saying this is how you need to deal with racism and homophobia and stigma in the community. You need to tell me how you think you should deal with it.
When you look at to beat HIV, do you see that as a model for black healthcare going forward, right? Trying to create these models of crowdsourcing. I think about the work that, say, Gary Bennett is doing here at Duke around utilizing technology, right? At least to kind of get a sense of where people in their bodies are. But do you see crowdsourcing as kind of a legitimate way going forward for us to address more broadly healthcare disparities within black communities?
Yeah, I mean, crowdsourcing is really a general term for it's done for drawing information. It's been done in multiple different ways. So
in some ways, it's WebMD.
Right. Well, WebMD, Wikipedia, Kickstarter. Those are different types of ways that you can use, or even Twitter. I would say is a form of crowdsourcing, in the sense that people are contributing their ideas and working with each other and talking about these issues and teasing apart what's happening in the news. With each other, and there's other ways that they do crowdsourcing, in the sense that they might do a competition where people submit their ideas, and that's a lot of what I do. But really, the crux of it, I think, is understanding and trusting that people have expertise in their own lives, and they know what they need. And I think that at the core is something that can be applied to community engagement or any type of work across the board.
You're a researcher, you're working in the sciences. This level of research doesn't occur without a real partnership between institutions like universities and colleges and the federal government. We're at a moment now where there is a change of national leadership. And when that occurs, priorities change. Are you concerned at all with the change in leadership in Washington, that the way that you've been able to use federal government resources to do this research, are you worried at all about there being dramatic changes in the work that you do? Yes and no.
I mean, part of it, I'm worried about my salary. But as
Real
far
talk,
as, but I try to take lessons from my parents and my grandparents who had to deal with similar issues, in the sense that you don't rely on one source of funding or one source of anything. That we as a community can do this work even without money, right? And they have been doing it without money for a long time. Actually, the fact that there's money being put into HIV cure research now is a brand new thing. Like, people have been doing this work for 30 years without extensive funding. But I think it's also about being creative in the way that partnerships are important, because most of the organizations and businesses that I'm working with don't have a lot of resources. But when you pull those resources together and you collaborate and you coordinate with each other, then it makes that little pot of money more efficient. And the other thing that I wanted to say was that I think through this project, it's really a focus on entrepreneurship, which I hope is something that, you know, is celebrated and not clamped down like it has been done in the past. So I'm trying to be optimistic in the sense that even with this change of guards in the government, that they still, you know, tout that they support small business and entrepreneurship. And so I'm hoping that will continue. And we've actually, ironically, gotten the majority of our funding from Republican leadership like George Bush. So, so I'm trying to stay optimistic about it.
You've been watching Left of Black, and we've been joined today by Dr. Allison Matthews, who is a postdoctoral fellow in the Institute for Global Health and Infectious Disease at the University of North Carolina at Chapel Hill. Thank you for joining us today, Dr. Matthews.
Thank you.
Black lights and booze burn when I record for Watts, and every black like Troy Davis who never had a fair shot. All black everything, everything black, culture over everything, y'all. We taking